In tonight's Health Alert, it is almost hard to believe, but this month marks 5 years since COVID-19 put a stranglehold on Memphis, the Mid-South, and the world.
Yeah, that was an unforgettable time. Many of us had to work from home. There were lockdowns, and globally, tens of thousands of people died. Tonight, WREG's Alex Coleman talks one-on-one with Dr. Steve Threlkeld about his memories and how COVID is still with us today.
Today, the World Health Organization officially announced that
it was 5 years ago this month. The World Health Organization declared COVID-19 a global pandemic, shutting down daily life, causing death, crippling the economy, and reshaping public health around the world and here in the Mid-South.
I think New York, in terms of the impact it was having, so we were very worried about it. But I don't think we were as worried about it maybe as we needed to be. It turns out in retrospect,
we've seen a wide variety of how it behaves.
In Memphis, Dr. Steve Threlkeld, an infectious disease specialist at Baptist, was one of the many health experts on the front line. He remembers one of the first cases confirmed in Shelby County involving a coworker.
And Marilyn, who's become something of a hero to all of us subsequently, worked at the hospital, actually. And so I got a phone call when I was out to dinner with my wife and daughter who's visiting from college, and that the test was positive. And I told them at the time, well, things are about to change around here, unfortunately, and it's not going to be good.
At first, there were not many answers about COVID.
No, we really didn't. Certainly. And the worst thing about it was that we didn't know what to do about it. Even as we learned more about the virus, we were just doing supportive care.
COVID didn't just make people sick, it also divided society.
But the most depressing thing to me about it, other than, of course, the actual people dying of the disease, and we had that going at up to 10 a day, even just in our hospital, and that's very difficult to watch. But we saw people divided around things like vaccines in ways that I just truly didn't even understand.
It also took a toll on first responders.
But I think the nurses had it the worst. I mean, they were the ones that were in the rooms with people dying whose spouses and families couldn't be around them. Tremendous emotional toll. And I very frequently say that my worst memories of it were nurses with their own cell phones, video conferencing with families, trying to say goodbye to their relatives. And you don't endure that sort of thing, particularly the nurses, without being changed by it.
And right now, as the country deals with a measles outbreak and cases of the bird flu, Dr. Steve Threlkeld hopes we've learned some lessons since dealing with COVID-19.
So it's very sad to see that sort of thing popping its head, and you just hope that we can come together and not be going down some sort of historical road here, because I think that would be sort of a tragic kind of event.
Reporting for your news leader in Memphis, Alex Coleman, WREG TV, News Channel 3.
All right, and still dealing with the fallout from COVID. According to recent data from the World Health Organization, from mid-January to mid-February, about 3,800 Americans were hospitalized due to COVID-19. So the virus is still out there.